Documentation by clinicians other than the patient's provider. Code assignment is based on the documentation by the patient's provider, i.e., physician or other qualified healthcare practitioner legally accountable for establishing the patient's diagnosis. There are a few exceptions when code assignment may be based on medical record documentation from clinicians who are not the patient's provider, i.e., physician or other qualified healthcare practitioner legally accountable for establishing the patient's diagnosis. In this context, clinicians other than the patient's provider refer to healthcare professionals permitted based on regulatory or accreditation requirements or internal hospital policies to document in a patient's official medical record. These exceptions include codes for body mass index, BMI, depth of non-pressure chronic ulcers, pressure ulcer stage, coma scale, NIH stroke scale, NIHSS social determinants of health, SDOH classified to Chapter 21, laterality, blood alcohol level, under immunization status. This information is typically or may be documented by other clinicians involved in the care of the patient, e.g., a dietitian often documents the BMI, a nurse often documents the pressure ulcer stages, and an emergency medical technician often documents the coma scale. However, the associated diagnoses such as overweight, obesity, acute stroke, pressure ulcer, or a condition classifiable to category F10 alcohol-related disorders must be documented by the patient's provider. If there is conflicting medical record documentation, either from the same clinician or different clinicians, the patient's provider should be queried for clarification. The BMI, coma scale, NIHSS, blood alcohol level codes for social determinants of health under immunization status should only be reported as secondary diagnoses. In summary, most diagnosis codes come from the patient's main provider, but some codes like BMI, ulcer stages, coma scale, NIH stroke scale, social determinants of health, laterality, blood alcohol level, and under immunization can be documented by other clinicians such as nurses, dietitians, and EMTs. However, the main diagnosis, like obesity, stroke, or alcohol use, must be documented by the provider. These exception codes should only be used as secondary diagnoses. Stay sharp, coders.